Welcome to the NCOH monthly webinar. My name is Martin Hoek. I'm Communication Manager for NCOH and your host for today. Please remember that this meeting will be recorded and made available through the NCOH website and our YouTube channel. Please subscribe to the YouTube channel. This webinar will be slightly different format than what you're used to, and also slightly different from what we announced. Unfortunately, Dr. Maria van Kerkhoven is unable to join us today. She was very disappointed and she promised she will partake in a future webinar. But don't leave, because we still have two excellent guests, Professor Marion Koopmans and Dr. Ben Embarek. And then regarding the format of this monthly webinar is that our guest first will give a short 15-minute presentation, and then we'll have a 30-minute discussion. And we did this deliberately because you know our guest from television and all kinds of other media outlets and interviews. And we really wanted to give you, the audience, a chance to pose your questions to our guest today. So please use the chat function to post your questions, and then following the two presentations, we'll elaborate on the questions that you have for either Professor Marion Koopmans or Dr. Ben Embarek. First, we start now with the first guest of today, is then Ben Embarek. He's a food scientist and joined the World Health Organization in 2001. He worked at WHO's China office and advised the Chinese government on food safety and nutrition. Between 2014 and 2017, he managed WHO MERS-CoV virus task force and coordinated investigation into the animal source of the virus. He is one of WHO's top experts on zoonotic diseases. And in 2020, he was a mission head of the WHO team investigating the origins of COVID-19, which of course is not 2020, but already 2021. I mean, it's going so fast, one whole year of a pandemic. Dr. Ben Embarek, thank you for joining us. The floor is all yours.
Thank you so much, and welcome to everybody to this exciting webinar. Yes, so I'm working in WHO, the World Health Organization, at its headquarters in Geneva, and I've been working in WHO since 2001, and almost all the time here in Geneva, but I was also a couple of years in our China office, working there on improving food safety in the food safety systems in China. As part of my work, I'm managing a network of all the national food safety authorities, a network called InfoSan, and we use that to manage international outbreaks related to food. We use it to help recall shipments of contaminated food that are exported in different countries. And we see more and more of these larger outbreaks involving many countries because of our completely integrated and interconnected world in which we live these days. And as part of that work, I'm of course also involved in some of these interesting outbreaks of new emerging diseases, because many of them have a link to the way we're producing food. They are often emerging at the interface, what we call the animal-human interface or human-animal interface. And they are often emerging at that interface where human and animals are in close contacts. And that can be in markets, it can be in farms, it can be in other places or it can be while people are hunting animals for food, for example. So all of these have somehow a link to the way we produce food, raise animal for food, hunt them for food, etc. If you remember, one of the recent important one was the series of outbreaks of bird flu, H5N1 in particular. We had about a decade ago, and there it often transmitted from poultry to humans, in particular at that interface, either in markets where people were going and buying live chickens in some countries, or where people were holding and raising chickens at home. And often there, the food chain was a very short food chain of somehow less than a couple of meters between the live chickens and the cooking pot, and where people were eating these animals. So these are not foodborne diseases, but they are somehow linked to the way we handle and produce food in different environments, different settings. And that's what I think make them very interesting and for us, and in particular for me, to work on. And I've also been working in the response to the MERS outbreak in the Middle East a few years ago. And there we worked closely with Professor Marion Koopmans and her colleagues at Erasmus in trying to discover the source of the MERS outbreaks. And that's in that process we were able to make the first connections between human cases of MERS and the camels, the dromedary camels that are living and playing such an important part in the Middle East. And that was a very interesting period where we were trying to discover and understanding the link of this disease with, again, with a very common animal in that part of the world playing a very important role. And when you are dealing with that kind of events, you of course have the scientific part where you try to look and find the source of a disease, but then you have also all the social, political, economic environments around it that you also have to understand and take into consideration, in particular when you want to communicate your results, when you want to communicate the way the response should be developed to address these events. And more recently, as you said, that was part of the response of COVID at the international level, working in WHO. And since the January last, a year ago now, more than a year ago, as you said, time flies. I've been part of the response team on COVID-19, particularly focusing on the link to food and on the origin of this virus. And since the beginning, we were trying to work on discovering and helping discovering the source of this virus. And it's always complicated work. None of the previous big emerging zoonotic disease events have been, the origin have been solved quickly. It often takes months, years, or even more before we identify the source of these emerging diseases. And in the course of last year, I've been part of the team that last July went to China to discuss and decide together with China how we should go about finding the origin of this virus. And that was following a decision by all the member states of all the countries, members of WHO, that WHO should work with China and in collaboration with FAO and OIE in trying to understand the origin of this virus. So that's what we agreed upon in July. And there we agreed that we should conduct a series of epidemiological studies in Wuhan to start there, because that's where the first cases were detected, and to also look at the market, the famous Wuhan market that was initially thought to be the source of the event, and try to understand what came in and out of that market back in December 19, try to understand what happened and how the virus spread in that environment at the start. Also trying to do a series of retrospective studies to try to find earlier cases than the one that were detected in December, because the more we can go back to the first cases, and the better is the chance to find the link these people have with the original source of the virus. So many of the studies were conducted in the period July, August to the end of the year. And then we assembled an international team, of which Professor Marion Koopmans was part of that team, and we went to Wuhan in January, on a cold January day, to Wuhan, and spent the month there with this a group of Chinese colleagues, working on looking at all the studies that had been done up to now, looking at the results, try to understand what happened back in December 19. We visited a lot of interesting places, among others the Wuhan market, the hospitals where the first cases were detected. We talked to a lot of the doctors and people who were involved in the first days of this event. We also visited the Wuhan Institute of Virology laboratory with a lot of experience in looking at coronaviruses, in particular bat coronaviruses, and who also, as everybody knows, have been also as part of all the discussion of where the virus could have happened. And so we had some excellent discussions there as well. We also visited some of the other laboratories around the city who were involved in tracing and detecting the first viruses. And at the end, we got quite a good understanding of what happened in December 19 in Wuhan. The virus was circulating much more than we originally thought. And we also got a good understanding of what was going on in the market. At that time, we were able to trace the most interesting products coming in and out of that market in terms of, in particular, products coming from farmed wild animals produced in different parts of China, who were transported and sold in that market in frozen conditions. So again, as you may have heard, the frozen products as a possible vehicle for the virus is still worth exploring further, better understanding how the virus persist and stay viable in this type of environment compared to a more normal temperature, humidity environment, and so on. So a lot of interesting lead for a second round of studies that hopefully will start soon and help us to get step by step closer to the origin of the virus. It was a very tense, tiring, but also exciting mission. We learned a lot. We had some great discussions. Of course, we didn't find the source, but that was not expected. As I said, these take times, but the fact that we have started that process and new studies are planned, and hopefully other missions will also continue the collaboration work on many of these studies, will help us getting there closer and closer. And it's important that we keep that international collaborative spirit, collaborative approach to conducting these studies, because that's where we can bring the best out of all the science and all the scientists in different research groups in the world with different mindset, different approach, different experiences, and bringing all these good experiences together is really what will help us to get there. And that's important to keep in mind. I think I will stop here and be happy to answer any questions or clarification. Thank you.
Thank you, Dr. Embarek. It's really interesting. There's already a couple of questions coming in, but for now, I would just want to switch to the talk by Professor Koopmans, and then we have a plenary discussion, of 30-minute discussion to answer or have all the questions from the chat for you, and then you can discuss with Marion. Maybe that'll be interesting. So, Professor Marion, the floor is all yours. Oh no, oh, so sorry, it is not actually, because what would it be without a proper introduction? Sorry, I was so caught up in the good story by Dr. Embarek. Right, Professor Marion Koopmans, he's the head of the Erasmus MC Department of Virus Science and an expert in zoonosis, including the coronaviruses. He was the brain behind the development of rapid diagnostic tests for the Ebola outbreak in Western Africa in 2015, and also for the Zika outbreak in South America, also in 2015. Her focus is not only on a fast laboratory work, but also on early detection. She is the initiator and leader of a large network and consortia for the early detection of infectious disease outbreaks, such as One Health Pact and VO, and is a strong advocate on open data and data sharing. Because of her expertise and mandate, he's a member of the WHO Scientific Advisory Group and also took part in the international team of experts studying the origin of the coronavirus in Wuhan, China, on behalf of WHO earlier this year. With further undue delay, Professor Koopmans, the floor is all yours.
Okay, enough. Okay, so yeah, so I will give a bit of a flavor of what we did and what sort of some high-level findings of our mission in Wuhan, China, the one that Peter Ben Embarek just introduced. And here he is exiting the plane, because as you all know, China has pretty much controlled this virus, this pandemic, as one of the few countries in the world, which means they are very strict and stringent on people coming in. And so we were received to be moved to the mandatory 14-day quarantine. And even after quarantine, throughout the visits, what you can tell is evidence of just the seriousness of disease tracking and surveillance that China has put in place here, just with these kind of temperature screens wherever we would enter a building. Just a big difference with the way things are organized over here. But then to the mission, as Peter Ben Embarek just explained, essentially, so looking for the origin of a pandemic can actually be a very long, it's a big question. And we did not expect to find it on the first go. So really the focus of this first mission was to get to understand everything there is to know about what happened exactly in this very first phase of the pandemic as we have come to know it from the reporting in Wuhan. So that work meant that we've co-designed with our Chinese colleagues a series of additional studies to review available data, to look for additional data and analyze them to find evidence for when exactly did this start in Wuhan. So these were epidemiology studies, virological studies, and animal and environmental studies. And the biggest part of the work was also bringing all the little pieces of the puzzle together into an integrated picture, which is more challenging than you would think. So just a list of the types of studies that have been done, and each of them can easily take an hour talk and discussion. So it's a flyover. So of course, we know that the first disease notifications in Wuhan were from end of December. And one of the questions is, when exactly did this happen? When did the disease reporting go up? So, and there are different types of surveillance systems in place. So those were all reviewed to see, was there earlier evidence for increased illness? That was also done for mortality statistics, patient records from a large number of healthcare centers with their medical teams. They were asked to look back, is there, with what you know now of SARS-CoV-2, is there maybe earlier cases that you think could have been this infection? And then for the ones that were selected in that way, go and look into where were they, what were the risk factors and possible exposures. So here just a very brief flavor, and the full information will come out in, let's say 2-3 weeks, 1-3 weeks, something like that. Where you can see that before December, there really is not much of a change in illness reporting, influenza-like illness or severe acute respiratory illness. But you do see cases popping up from the clinical review in December. Some of them linked to the market in blue, some of them not linked to the market. That was thought to be the source. And here, this is I think, a person that should be famous. This is the clinician that notified the first case, picked up the phone to the Wuhan CDC and said, there's something weird about this patient, particularly when she also got a second contact with a similar type of pneumonia that she felt was unusual and thought was viral. So this is an example of the type of analysis. This is looking at mortality statistics, where you see, okay, there's clearly a start of mortality here. But again, that's already well into January, so no evidence for earlier severe disease reflecting widespread circulation. You all know by now the National Disease Reporting System, where excess mortality is plotted every week. And similar things were done over there. And what this arrow shows is the position where the market sits within the municipality of Wuhan, so quite central. And that's also where, of course, initially some of the studies were focused. And here is us at the market. The market was closed down and is closed down. But we went there just because it gives you a good feel when walking around of what this market was like, and it is a typical Chinese market, I would say. Peter can comment on that as well. With the stalls and with a map of the market showing where the cases had been. But also our colleagues really mapping out what was sold in all those different stalls. Huge amount of work that they have done. And that goes into trying to understand what people had been exposed to. Aquatic products, meat, different types of meat, and wild animal meat, which of course is something we were very interested in. They also brought together, or we brought together, genomic data. You are all familiar with the virus genomics and how what that can say about how cases are linked. And this is a diversity plot from the first month, where you see there's already diversity and there's already cases in different parts of this diversity picture. So saying there was already something going on, maybe not linked to the market. And what our colleagues did was for each stall that had potential high-risk products, go back and dig in and do a trace back of the supply chain. And that's, so there's been comments out in media of there's nothing shared, nothing being done, and that's really far from the truth. That's why I'm showing this. So here's just one example, a stall. Here this is the name, plotting which animals were sold there and where they had come from. And that then was done for that whole big market, which led to several provinces in China, led back to several provinces in China, but also 58 countries outside of China. That's how international this market system has become. And that's important to realize. And the trace back from that market also, as you can see here, led back to farmed wild animals, which is, of course, something that from an emerging disease perspective, we're interested in looking at. And these animals were also from regions that we know are hotspots for bad SARS-like coronaviruses. They also did huge amounts of testing, just flagging the large number of animals and the numbers here, big amount of testing, but also that there may be some things lost in translation. Here looking at the names that popped up in the translated list of animal species, but just to show that there's been a lot of testing, screening by molecular assays and by serology to try and identify what this virus, where this virus came from. And so far that has not yielded anything, but there is, of course, by now a couple of publications out there where from which we know from the original paper that there is a bad SARS-like coronavirus that has been found in West China, and that is the most close relative to the pandemic virus, but now also two independent findings of pangolin coronaviruses that are quite similar to the SARS-CoV-2. Now, with the initial finding, the initial pangolin paper, my thinking was that maybe this was just an outbreak in pangolin because there was a group and several of them tested positive. But now with having another publication with pangolin in a separate location with a different lineage, I think we have to conclude that pangolin are reservoir hosts for SARS-like coronaviruses as well. So it makes sense to continue to look for closer relatives in those species. Some of them were screened as well as in the China study, but so far no closer relatives have been found. That also puts you in the direction of regions where a lot of the bad work so far that's already out there in the literature has been done. And that's southwest China, south China, but also in neighboring countries. And this is where the comments about maybe looking for the origins of this virus outside of China also come from, and they make sense if you look at this from, for instance, the bat ecology perspective, but also if you look at it from thinking about where pangolin come from. And so that's just a flyover of some key aspects. And we have recommended further work. You've probably heard of that. That's been also in the press briefings to continue or to do next steps in the trace back to where the virus may have come from. This is the team. As you can see, one of the benefits of having 2 weeks rigorous quarantine, really locked up quarantine, is that after that we were actually able to have a joint dinner again, and I can tell that that was really one of the fun parts of the trip.
Thank you, Professor Koopmans. It's really interesting. And actually, there's a couple of questions related to the picture you just showed us, to the consumption of food, to the market you described, and Dr. Embarek, to your expertise. This question is from Sophie. I imagine in the big city of Wuhan, there are more markets that sell wild animal products. Considering that the earliest cases may not have been linked to the Wuhan market, what about other markets or wildlife meat or wildlife supply areas in Wuhan? Any investigations being done for these? So what makes this market in Wuhan so special? I mean, why there?
Peter?
Good question, and of course, a question we have discussed while we were there as well. And clearly, the reason why the focus has been from day one on the Huanan market is that among the first cases that were detected, quite a lot of these cases had a link to the Huanan market. They were working there or have somehow a link to the market. And therefore, initially the focus was on that one. But we should not forget that at the time, and basically all the cases that were detected in December were severe cases, because at that time, that was the definition of COVID cases. It was a severe pneumonia cases. Since then, we've learned that there are also a lot of mild cases and a lot of asymptomatic cases, and these were never detected in December 19. So around the cases we know, there must have been a lot, if hundreds, if not more, mild cases or asymptomatic cases that we don't know about. And we also know that some of our cases, the severe cases we're aware of, some had no link to the market. So clearly there were also other parts of the city that would be interesting to look at. Other markets are, of course, also on the radar, and so far not much have been done in looking into the other markets of the city. But that will be one of the recommendations that we have for the next round of studies, is to do a much more systematic study of all the markets, their supply and comparison, and see if some of them have also interesting features or products or that would be worth exploring. So it's still early days, and hopefully we'll have more fingers in more markets in the coming months.
Can you tell us more about the type of studies that have now been or will be set up following your mission to China?
It will be a mix of studies. Some will be follow-up studies, clarification studies of some that have already been done and that we looked at, where we didn't have enough time to do proper full analysis of what was already there, or where we got ideas for additional follow-up studies. And then a series of studies that are new studies, where we look at new things. For example, looking at in more detail at the areas where the farmed wild animals were raised in some interesting provinces in the south, for example. That's new. Looking at samples from the Wuhan blood bank, retrospective studies there, that's something new as well. Looking at the other markets will be something new. So there is a mix of follow-up and new studies. Marion, maybe you want to elaborate on that as well.
No, and I think it's I second that, and it's following the leads from this first piece of work. So the first piece of work said so the widespread circulation clearly was ongoing in December, but from everything that has been looked at, really no signal of that whatsoever before December. But it would be good to then do a much more granular assessment of that through a population-wide sero survey in that region in November. And that's and then the same, so stepping back or treading back from the market. Well, so there is sort of leads of potential introduction routes, follow those back and do the next step studies there. And that's what's been the intention all the way around, because there's a lot of hypotheses. China is a vast country, but what we set out to do is just look at what is the evidence and what is then the next step. That's really the process that we embarked on.
Okay, and if we look back, so now we were looking in the future, but now we're going to look back. You say it may take months or even years before you find the source of the outbreak. It seems as time goes on, it only becomes more and more difficult to find the source, right? So as a layperson, how do I understand, how does that go? How do you go about that? And how do you follow a lead that is slowly disappearing in time? And linked to that, If that's one part of the question. The second part of the question is from the audience is that there have been several scientists that speculate the virus could have escaped from the Wuhan laboratory, but in your press conference you dismissed this possibility. And linked to looking back into the source of the virus, can you tell us more reasons why you dismissed the laboratory?
Maybe I can start with the first one. So yes, time is passing, but that doesn't mean, so we know the viruses are related to viruses in bats. We know that if you compare them genetically, there is a missing link for at least for a couple of decades. So this is about what could be in between. Now, an option could be that there is really a very short-term spillover, like we have been seeing in our mink, for instance, and a one-off accident, essentially, and then introduction into the community. Those would be difficult to track the longer out you are. But if you think about potential other intermediary hosts like the pangolin, then this will still be possible. So one of those follow-up studies that we've discussed and that I've recommended is, well, do surveys in the more likely reservoir hosts to see if a more closely related virus can be found, if that gap that we have, the molecular gap that we have, can be closed. And those are based on a lot of the work that has been done, for instance, by the Wuhan Institute of Virology. There's pretty good ideas about what are hotspots. So where in the country, but also in the wider region, those surveys could be targeted for, you know, to have the best chances of actually finding something. And those are the kinds of studies that still will be very valuable. And I forgot your other one.
Well, how does it link, Dr. Embarek, to your statement that you think it's highly unlikely that it actually comes from the laboratory? I mean, Professor Koopmans explained to us the gap that we see now, the couple of decades gap in genetic makeup of the virus. Could you tell us more about that?
Yes, we looked and discussed a lot, of course, the possibility of a lab accident or lab release unaware release, for example. And there are different labs in the city, and we visited all of them. And taking the most prominent one, the one that has been just the source of many of these discussion, the Wuhan Institute of Virology. Everybody, of course, back in the early days of the event in January, February 2020, that was a lot of the first reactions that, oh, there is this lab in Wuhan who was working with coronaviruses, must be a lab accident. And we had the same initial thoughts. I'm sure many of in the meeting today also had the same thoughts. The staff in the lab, in the Wuhan lab, had the same thought themselves. They said, "Oh, can this have been leaked out of our laboratory?" And they went straight back to their collections of viruses and their works and to look whether they had this virus in their lab or could have been the source of such a leak. So it was a natural reaction to think about that. But then there have been no evidence put on the table or put forward. There have been a lot of accusation, of course. Again, there is nothing that point to that apart from the fact that the lab was in Wuhan. But we don't even know if the start of the outbreak was in Wuhan. We could potentially have had the start somewhere else, and the first detected events or group of cases or cluster of cases was Wuhan, but they could have been coming from somewhere else. And when we start looking at the genetic makeup of the initial sequences we have from December, again, nothing point to one single source there. So it's so for our work, this was not when we looked at all the hypotheses we were discussing and working on, this was not the most likely and the one we would continue to work with as a matter of priority. We have other studies, other leads that are much more interesting and much more plausible to yield interesting results that we would like to push forward first and start looking at first. And therefore, we put the lab accident as something unlikely for us. But it doesn't mean that it's a done issue and that we will never look into that hypothesis again. But should more evidence be presented or a new result point into that direction, of course, we will revisit that hypothesis, or others could also push for that to be looked further in more details. We should also not forget that the difference between this hypothesis, the lab accident hypothesis, and all the other hypotheses is that the type of studies and the type of scientific studies we have done up to now, and we would like to continue to do jointly among scientists, that's the kind of studies you do to look at the other hypotheses, the animal intermediary host, the direct jump from bats to humans, or even the role of the food as a vehicle, potentially. While if you want to explore further the lab hypothesis, there it's a totally different type of studies. Then it's not a series of scientific studies that will tell you whether the lab could be the source or not. There you need to do a much more audit type of investigation, the real systematic audit of all the activities of the lab, all the audits of the lab, all the working procedures of the lab, looking at the books, looking at the and so on. And that's a very, very different type of work than what we are embarked in these joint studies. So we discuss it, of course, because it was interesting and important to put it on in the report and put it on the table and discuss it. But it's not something that we will be able to move forward in the current group we have.
No. And you have been now twice to China in early 2020 and early 2021, and following your last mission to China, do you foresee another group of experts traveling there anytime soon? Or do you think a team may go to another country where the virus may also have originated from? How do you think the next steps will be from the WHO point of view?
We will hopefully continue to have these interaction and joint activities with colleagues in China in the coming months. So I foresee that will be a continuous process over the coming many months. Whether next mission will go very soon or in a few months' time, I don't know yet. It will depend how we plan the new round of studies, and maybe we will send several smaller teams, more specific teams, to help with certain studies, or we may send again a similar or the same larger group to do a more, again, evaluation type of an analysis type of collaboration or presence in Wuhan. So it will depend a little bit how the work proceeds in the coming weeks and months.
Yeah. We got one more question regarding Wuhan. Is the specific factors? I mean, you elaborated already a little bit on that, about that there's many more markets like Wuhan in China and in other parts of that world, actually in Southeast Asia. But are there specific factors in Wuhan that led to such an explosion of the virus there?
That's a difficult one. Wuhan is a big city, very with a lot of areas where you have a high concentration of inhabitants, on a very small areas. You also have it's a very dense city in some part of it. It's an interesting city in itself. The geography of the city is very particular, but in certain areas you have a lot of very high density housing, which could, of course, when you have a lot of people closely together, that's conducive to transmission of respiratory diseases. You also have these traditional markets where you potentially have spillover events or transmission of viruses to humans. And when you combine the two things, then you open up for an initial point transmission in a market, for example, and combine that with a high density population in a very large modern city with modern, tight, close public transport, for example, and a lot of human contacts constantly. And these two combined can potentially amplify this type of event. But otherwise, why Wuhan rather than another city? It could have been several other cities at the same time, who knows? But Wuhan, because it's a modern city, has also a modern, efficient public health system and disease surveillance system in place. So in that kind of environment, you're much more likely to pick up cases of an emerging disease rather than in the places where you don't have a good surveillance system in place and where you would most likely miss it, or if you are not used to see new diseases or infectious diseases of a particular type. So all that, at least in my mind, are probably factors that played in. But again, there is a lot of unknowns. I don't know.
And I think there's more places like that. So if you see, there has been resurgence of SARS-CoV-2 in certain places in China. So the reduction has been virtually completely controlled, but every now and then it pops back up. And one of the bigger ones was also centered around a market, this time in Beijing. So we also looked at that and we discussed with the people that did those studies, because it had quite some similar aspects. So it is places which have, I don't remember exactly, Peter, but I think they were talking about 10,000 visitors a day or something like that. So huge amounts of people. So if something happens there, it's easy to, to see how that would lead to a big spreading event. So I think that's a commonality. So there, and the rest may just be bad luck.
And in terms of reservoir, where does the virus stay? Why does it pop up? Do you have any further ideas on that? I mean, you mentioned the pangolins. I've got a question about exotic animals also at home, or food that is frozen at home possibly from Wuhan market, or who knows, from any market now that has been infected. Why do we still see the pop-ups in China where the control is very, very strong and very good? Why do we still see that?
Well, so that's of course something that we also discussed. So what we have looked at and discussed is the evidence. So with every new case, there's a big investigation, and with some of that also sequencing ongoing. And based on that sequencing, the conclusion has been that these are imported viruses. We've discussed that maybe the sequencing effort needs to be bigger to draw that conclusion with certainty. And based on the epidemiological investigations, the conclusion has been that, hey, maybe there's something associated with imported frozen foods. You all know the story that has been in the news. these are still hypotheses. What could be, what we visited one of those big warehouses where that kind of food comes in, which is screened very actively, where very rarely something is found, but it could also be something with so that those products are brought in and then are handled, repacked. You know, there is opportunity for contaminating something if you are working with people from different parts of the world that is in a pandemic. And then there's travelers that have been that have brought the infection back.
Yeah.
It's a mixture, and I think so. That's one of the things we said is maybe expand your sequencing to get a better, underpinning of the conclusions there.
Yeah. Then we switch to the mutations we see and the COVID variations that we see. We see some from England, of course, that we all are well aware of. We see some from Brazil. We see some from South Africa. And we know these are just the ones that are notified to us because they are different or they are causing us more concern than many of the other mutations that are happening. Do we also see mutations from eastern part of the world? Because so far this is mostly, limited to small part of the world where we see concern about mutations, and coronavirus is a fairly large virus. So how does it work, the mutations? How is it possible that it mutates so much?
Well, it doesn't mutate so much. It actually still is not it's one of the slower the viruses with a lower mutation frequency, but it's circulating massively. So with that you get mutations. That's what happens. So there's mutations all over the genome, but what you're talking about is some of the mutations that may change the properties. And of course, we are now looking at the variants of concern, and they have a set of mutations, and they are of concern because there is indication or evidence of increased transmissibility in the case of the UK variant and the South Africa variant. And there is also evidence that there may be some escape to antibodies from previous infections or from vaccination. And that, of course, is not something that we want to be seeing, both transmission increase and escape from antibodies. And the third piece of information is now with the UK variant is there is accumulating evidence that the infection leads to more severe disease. Again, something you don't want to be seeing. Now, the question, does that also happen? It could, of course, happen everywhere, but what the current ideas are about where do these variants that are really sort of they have been positively selected, so they have a lot of mutations, relatively speaking. Where does that happen? Well, that happens in populations where there's pressure. So that happens where there is widespread circulation in populations that already have some level of immunity. That's one hypothesis. The second is they may evolve in people that are immunocompromised, but still have some immunity, and maybe people that are then treated with antibodies. And the third is they may happen when the virus passages through animals, like we've seen in the Netherlands with the mink farms. So that, of course, can happen everywhere where there's widespread circulation. But if you look at China and several Asian countries, that compared to the US and Europe, the chances are much bigger that those kinds of variants pop up at our part of the world now.
Yeah, interesting. Thank you. Let's see what other questions we have. We had some other questions you already answered on the variant, I see.
I saw there was a question in the beginning I did not manage to answer about the circulation of the virus in Wuhan in December.
Yes, which is much higher than anticipated.
Yeah. Just to clarify that one quickly, what we originally knew from the initial investigation and detection of cases was that there was initially about 40, then about 100 cases, and so in Wuhan in December. But while we still have some less than 200 cases confirmed for December 19, we also can see from other data, excess mortality statistics, etc., that there was many more cases in Wuhan already in December, and in particular the second half of December. And again, all these cases were severe cases. So we know that around the less than 200 confirmed cases, severe cases, there must have been hundreds of mild cases as well. And that's why we can say that the virus was circulating much more substantially in December than originally thought.
Very good. And Dr. Embarek and Professor Koopmans, you know each other very well. You've been on several missions together to China, to the Middle East. Where do you think the next Disease X joint mission of you will be?
I hope that the next one will be on a tropical island in the Pacific. We can go there and have some nice environments and not be in a quarantine hotel or in a
nice daiquiri on the
desert with 200 degrees heat or other tough conditions we've been through.
Yes, yes, that is a good answer. I hope so too for you, because being in quarantine for that long cannot be much fun. That must not be easy. Okay, well, with that, I would like to thank you very much for your time and your insights. Our next webinar is going to be the 22nd of April, and we're going to be discussing the origin of viruses with David Quammen. And David Quammen is an American science, nature, and a travel writer, and he also recently published an article in the National Geographic. We will also have Dr. Raoul de Groot, a virologist at Utrecht University, and Matthijs Funk, who's a researcher at Erasmus Medical Center. So if you don't want to miss it, don't forget to subscribe to our newsletter and our YouTube channel to stay up to date. And thank you again, Dr. Embarek and Professor Marion Koopmans, for your insights and time. And we'll see you all next month.